Well, we're going to go ahead and get started. Good evening, everyone. I am Dr. Susan Buchholz. I'm the Associate Dean for Research here at the Michigan State University College of Nursing. It is my pleasure to moderate this broadcast of Conversations, which is a series of webinars sponsored by the college. Just a quick reminder, we've all been on Zoom a lot, but be sure to keep your mic muted until during the presentation. During Julie's presentation, we'll have breakout sessions and you can unmute during those. The topic of today's webinar is Renewal and Recovery, Coping with the Pandemic. And it'll be presented by Nurse Practitioner Julie Thomas-Beckett, who received both her undergraduate and graduate degrees from the college. Let me begin with the provider disclosure statement. Our speaker attests that no financial relationship exists between herself and any commercial supporting entity which would represent a conflict of interest or commercialization of any presentation content, and there are no CEs being offered today. We will be entering breakout room sessions at about the halfway point in the presentation where topics from Julie's PowerPoint will be discussed. A larger group discussion will take place after, where questions can be answered. Now, on to our presenter, Julie Thomas-Beckett. Julie, welcome.
Thank you, Dr. Buchholz. I appreciate you doing the opening, and I want to thank the College of Nursing and Marco especially for getting this started and getting this arranged. So I'm a family nurse practitioner. I have a busy family practice in East Lansing, Michigan, where I have seen patients from cradle to grave for the last 30 years. It's been a challenging time with COVID. An interesting time. I'm outpatient. I'm not in the hospital, so in some ways I have a little bit of survivor guilt, I guess, that I haven't had to be exposed to the level of severity that so many of our colleagues have. But it's a stress of a different sort, and we're going to talk about some of the challenges like that tonight. So I believe that our subject tonight, that of renewal and recovery, just basically coping with this pandemic, is one that we're all grappling with as a nation as we face the ravages of the Delta variant of COVID-19. And just when we were hoping to put away our masks and get back to normal, along comes a meaner and more contagious version of this deadly virus. So our objectives today, we're going to review the mental health effects of the COVID-19 pandemic. We're going to understand the challenge and the friction between public health and personal liberty. And then we're going to develop effective communication strategies for how do we cope with the tensions associated with this pandemic. And we're going to have an opportunity, which may be a little different for everyone in this kind of Zoom, to really talk and listen to each other. And I really invite us all to share some of their experiences along the lines of what we'll be talking about today. So we all know the story of the last 20 months of our lives, the highly contagious coronavirus killing and infecting millions across the globe, closing businesses and threatening economies and sending school and many workers online, the risks to first-line workers in food service and in health services, the adjustment to working from home, and the fears for those who are not able to be home and work from home. We know the numbers which seem to change daily. To date, the United States alone has experienced more than 650,000 deaths from the coronavirus. The latest surge of the Delta variant has filled hospitals and ICUs to capacity and beyond, particularly in states where vaccination rates are low. And we're only just beginning to explore the data on the incidence of long hauler or long COVID those who experience chronic symptoms well after their infection. I have too many patients with this, and it is debilitating and it is scary. I have a 37-year-old who contracted COVID in December. She had pneumonia, and she has not been able to work as a firefighter since, and she ended up on a ventilator last Thursday. That's 9 months after her infection. So it's scary. We also know the struggle created in our country and perhaps across the world between public health and individual liberty. Somehow this pandemic has been politicized to the point that the simple act of wearing a mask to protect our neighbor or our children has become a fight, pitting family member against family member and friend against friend. So for some, the mental health effects of the pandemic, for some, the pandemic has been a real strain to their mental health, causing anxiety, loneliness, depression, substance abuse. It shows up in the form of anger or isolation. For some people, just choosing to ignore recommendations from scientific data and how to control this pandemic. I tend to see a real difference in people in my office that and how they're faring kind of depends on where they land on the introvert-extrovert continuum. People who are introverts kind of like working from home. People who are extroverts are really struggling with isolation, and humans are social beings, and when our ability to be social is threatened, it feels like there are pretty serious consequences all along the life continuum. For some, the pandemic has had some really unexpected positive results. We're redefining what's important to us. We're spending more time with friends and family that are inside our personal bubble. People are redefining their work and making choices about their work. They're making choices that are unique and creative about their businesses and their education or their health routines. So there's always a way to make lemonade out of lemons. We just have to put on our creative cap and take some risks and do it different. And COVID for many people has been that impetus to create that change that they may have needed, but didn't have the courage. They were kind of pushed into it. So with the skill of nursing, we tend to address things through the lens of the biopsychosocial spiritual framework. And I really loved learning about this in my undergrad, and I feel like I look at the world in this lens. So I'm looking at COVID through this lens as well. So biologically, COVID's been a real threat to our biology. We are learning about and reacting to this novel virus that's deadly with long-lasting consequences, and we're scrambling to develop treatments and vaccines and supplies to cope with the onslaught of seriously ill people filling our hospitals and crowding our ICUs and straining the supply chain to care for these lives. So biologically, we've been challenged. COVID has challenged us psychologically too. It's challenged our psychological health as many address the anxieties and the fears associated with COVID and its potential to ravage our communities and our families. Working alone at home has been good for some and has caused depression and loneliness for others. Social isolation and separation is taking its toll on the elderly and children, and really on all of us along the whole lifespan. And the divisions and the vitriolic language, pitting the masked against the unmasked, the vaccinated against the unvaccinated, feeds an anger that just keeps us further apart from each other. And for some, this has been the biggest challenge of the pandemic. I can say for me, that's where the biggest challenge has been. And COVID has been transforming us socially as well. Obviously, we're on Zoom instead of being together. So we've adapted to virtual learning situations, virtual meetings, virtual school, virtual worship services and birthday parties and happy hour and game night and funerals, and everything has been, we're in a little box. Nobody wears pants anymore. Nobody sees us wearing pants anymore. So we've had to change a lot of our social behaviors. We're staying 3 to 6 feet apart, and we're not hugging, we're not shaking hands, and we make decisions on what we're going to do based on what the potential risk is and how many people will be there and what our comfort level is with that gathering. And I would say spiritually, COVID is driving the existential questions of our time. Who are we? What is important to us? What do we really care about? And how do we care for others? And if we care at all. So that biopsychosocial spiritual framework, I think, is helpful for us to understand that we're affected by COVID on multiple levels. Early in the pandemic, there was one of MSU's own, Lisa Laffman, who presented her detailed research on resilience. And I was very impressed by her work. And I think that I would invite anyone to view her presentation, as her framework really applies to every challenge we could face in our lives individually or as a family or as an institution. But she really talks about the following 6 points: that in any kind of resilience, to develop our resilience, we need to acknowledge the situation, name it out loud, put words on it, and then honor that situation and all that it entails, with any kind of pain or emotion or the challenges or the suffering or the joy. So to name it and then honor that we have the feelings and the emotions around it. And perhaps if we're able to do that, we can then take a deep breath, relax into it, maybe center ourselves as we're acknowledging and honoring it, and then potentially release some of that emotion around it. And then once we are able to release some of that emotion, perhaps we can reflect on what we've learned. And as we reflect on what we learn, we can develop a response, a way to, in a healthy way, to respond to this opportunity for resilience. So tonight, I have a couple of ideas and a couple of skills that I want to talk about and maybe review as we navigate this biopsychosocial spiritual aspects of this pandemic. And then in some ways, by labeling the struggle, we can acknowledge it, we can honor it, and perhaps when we relax and center ourselves, we can release some of that tension and that we have around the issues that we have faced during the pandemic. And as we're reflecting on what we've learned, then perhaps we can identify ways that we can respond in a healthy way. So first, I'd like to talk about that we have 2 feet, and we're making daily decisions as to which foot leads. And on one foot, we have public health. And that's a commitment to the efforts and sacrifices that are needed to help the greater good, to advance the health of the public, which then affects us individually. And on the second foot, we have personal liberty or individual liberty. That's our personal rights, our personal choices, our personal effort, and our personal gain. So I dare say that most of the struggles that we have in our nation today come down to a fight between these 2 feet. And we all have 2 feet. It's just which foot do we lead with? Now, the second is a concept which may be new for some and old for others, but it's the concept of positive freedom or negative freedom. So as you can see from the slide, positive freedom is the capacity to act upon one's own free will. So a positive right obligates others to act with respect toward the right holder. So a positive freedom is freedom to. An example of positive freedom is the freedom to feel safe from COVID by choosing to wear a mask, by physically distancing, by getting the vaccine so that infections will go down and we can get back to school, we can have businesses reopen, we can gather again. So on the other foot, there is the focus on negative freedom, which is freedom from external restraint on one's actions. So a negative right, it forbids others from acting against the right holder. So negative freedom is freedom from wearing masks, freedom from mandates, freedom from limitations on work, school, gatherings, individual liberty and personal freedom takes precedent for a negative freedom. Again, I dare say that most of the struggles that we have in our nation today comes down to a fight between positive freedom and negative freedom, between that freedom to and freedom from. So a way to deal with this struggle between public health and personal liberty, between positive freedom and negative freedom, are employing effective communication strategies. So as we practice the skills of resilience, there are some healthy ways to respond. So the first one we're going to talk about is the use of I messages rather than you statements. So you statements are, I don't really like you statements. When I hear a you statement, it feels like someone's pointing their finger and kind of, you should, you are, you know, it just feels kind of, I feel defensive and I feel angry, and I just feel like it's a really ineffective form of communication, and not much gets accomplished when a you statement is thrown at me. So I'm really trying to practice this skill of using I messages, which is what I like to call I own it. I always touch my chest and like own it. I own it. I put my hand over my heart. Like I own, I kind of look at it in a following kind of an acronym, I guess. I own what I see or what I observe. I own what I feel. I own what I need, and I own what I'm asking for. So the best way I can describe that is with an example. I like to tell stories, and I think it helps to kind of illustrate some of these effective communication strategies to kind of hear it applied. So there was an example this past a year ago. My father-in-law, his sister passed away, and it wasn't from COVID, but she died. And the family had asked everyone that was coming to her service to wear a mask. The church had asked everyone who was coming to her service to wear a mask. So my father-in-law went to the funeral, and his nephew, one of his nephews was there, and his nephew's the same age as he is, and he wasn't wearing a mask. So rather than feeling angry or scared or disgusted, kind of assuming maybe a passive-aggressive political statement, how could my father-in-law have addressed that? So using this idea of an I message, he could have said something like this. So I observe, I feel, I need, and I request. He could have said, I observe you're not wearing a mask, despite the risks of COVID and the request from the family and the church to do so. I feel at risk being by you for this deadly infection, and our only protection is a mask. I need to feel safe. So if you're going to stay, I'd really like you to wear a mask. And that's all owning it and not just pointing a finger at him, telling him he's a jerk for not wearing a mask to a gathering in public. So that's kind of an example of how that I message can work. And if we kind of think about it in that I observe, I feel, I need, and I request, thinking about those I messages in that kind of framework, it's sometimes more effective in a communication that's challenging. And I do this often with patients that they're having a struggle. I'll write it right out for them and maybe talk about what could, how this could be framed in that framework to get across your message, but own it. Another communication strategy that can be effective is called the Clara Method. I'm part of the Meta Peace team, and I have learned a lot about these effective communication strategies. It's an organization that teaches people de-escalation skills. I've written a book about it called The Work of Nonviolence, Stories from the Front Line. And I talk extensively about these skills and how they're used on the ground with peace teams or just with bystander intervention or just regular people on an everyday basis, how these skills are used to de-escalate and take the tensions down so that we can actually have effective communication. So Clara stands for centering, listening, affirming, responding, and then adding information. So I want to break that up a little bit because it's kind of a lot of letters. I get lost in the letters. So basically it comes down to like do that centering thing, just taking a deep breath, like kind of take a deep breath and do what I call get my mojo on here. And then I'm really trying to just focus and listen. And I'm really listening for the emotion behind what people are saying so that I can help reflect that back to them. And that would be where that A part comes into the affirm. Now, a lot of times we talk about it at the Meta Peace team that we just stay in the la-la land, that we're listening and affirming, we're listening and affirming. And if we're lucky and things kind of start to de-escalate, potentially then we can kind of move into the rah-rah part, which may mean maybe we add a little information or we respond. But until we really establish that listening part, excuse me, I gotta get a drink. I have a Michigan nose. Until we really establish that listening part, we're really not effectively able to move into a response mode and adding information. And too often, I think that's how things escalate, is that we aren't listening to each other. We're not affirming that we hear an emotion and we maybe align with that emotion, like I feel lonely too, or I feel angry too, or I hear disappointment or whatever. Just put a word on the emotion behind what we're hearing. And sometimes just feeling heard helps people de-escalate. And I have an example of that as well. And this happened to me in my office last fall. It was before the vaccine was available. And a woman came into our office. It was a white female patient. And my staff came out and said, wow, she's really angry and she won't wear her mask. So I got my N95 on, I have my goggles, I have my, my blue gown. I call it my potato chip bag because it's kind of crinkly. And I go into the room and she's sitting there and she's really angry. Her whole body language just communicated just really, really angry. She had her arms crossed and she was leaning back in her chair and she just started dripping with vitriol. And I could see her lips because she wasn't wearing her mask, but she was really angry. And she said, I live alone, right? I hate working from home. Work used to be my social life, and this is just a stupid virus, and we have to fight viruses every day. It's all China's fault. So now we all have to quarantine, and businesses are shutting down for nothing. It's just killing a bunch of old people, but 1 million babies are killed every year with abortion, and nobody says a word about that. Finally, the governor's rulings were overturned. I just hate wearing these masks. So I just sat there and I just felt like I was in the car wash with the windows down, just like, whoa, just all this anger just being spewed out. And it was disconcerting to me. And I was sitting there thinking, okay, I gotta all right, Clara, all right, listen, affirm, trying to hear her emotion. And I just kind of really figured she was in the non-thinking zone. So if I was to even try to respond, she would not have even been able to interact with me because she was not thinking. So I was listening and I kind of started to feel like she was sort of like calming down a little bit. She had gotten her tirade out. And so then I kind of picked up on the emotion and I could kind of hear like loneliness is what I kind of picked up on. So I was able to say, gosh, I really understand how hard this is. I understand how loneliness is hard. And I could just see her de-escalate just having said that. And I was then able to kind of let her know, I'm wearing all this PPE so you can be here. And so that I can be here and I can keep you safe. And we're asking you to wear your mask so you can keep me safe, keep my staff and their families safe. So I'm going to need you to put your mask on for me to do your exam. And she did. And I was able to do her exam. But honestly, I just recall feeling really kind of kind of shook up. It was really, really hard to be met with so much rage and so much anger. It was kind of frightening. But I had to quiet that voice inside my head, which just wanted to go to respond to all of her angry accusations and all of her angry tirade. But I didn't. I just listened for that emotion behind what she was saying. And thankfully, I feel like I labeled it right. And I could really hear her decrease in her anger, and she allowed the exam to go forward. But I didn't ever get to the response or the add information part. I really just had to stay in the listening and the affirming part. And although it wasn't satisfying, it didn't fix anything and it didn't change anything, but I had to be okay with that because the goal was my safety and her safety, and that's about all we got done that day. So she eventually left the office after the visit, but without her mask on. She walked down the hall with her papers in front of her mouth. But I guess that's the best we could ask for. But that's what Clara looks like. Potentially, if she had calmed down enough to be able to have an interaction, I maybe could have responded with some of the data or the facts about COVID and how to be safe. But she never got to that point of being able to hear any of that, and I didn't push it. So I just stayed in the listening and the affirming part. And sometimes that's all we can do is stay in the la-la land, and we don't get to rah-rah. Darn. So there's another effective strategy that's kind of like Clara, and this is taught specifically through the MSU Dialogue program. My daughter was a part of that when she was a student at MSU, and it's also a part of University of Michigan Intergroup Dialogues, which my daughter works with right now. And it's called PALS. So it's much like the Clara method, but this kind of framework might work better for how your brain works. But basically to just pause, basically that's kind of like centering, take that breath. The A is for asking questions to maybe tease out some of the feelings or some of the emotions behind what people are feeling. And then just listen to those emotions, listen to what that person is saying. And then potentially once we hear them, we could maybe speak our own truth and maybe even tell our own story to share that with someone. So I think this is another framework to think about it. So we're going to take some time now and break off into breakout sessions or whatever, chat rooms or whatever we're going to call it. But each of us at this Zoom call tonight, we're going to be put in 3 different rooms, and there will be a moderator in each of the rooms. And we're going to have time with each other to explore these questions and really talk about them with each other and really listen to each other. And the challenge isn't to make any judgment or to fix anything. It's mostly to just listen to each other and really share and potentially be a little vulnerable with each other as we share what some of the most challenging parts of the pandemic have been for us personally. And then maybe potentially share what has been a positive aspect of the pandemic. What have we been able to identify as something that was an unexpected gift of the pandemic for us? And then thirdly, what kind of skills have we called upon that we already knew potentially, or maybe developed, or maybe learned during this very challenging time of coping in the pandemic? And we're going to hopefully have everybody have a chance to share something of these answers with each other. So again, there's no one right way or wrong way to answer this. It's just an opportunity to share. So I'm going to ask Marco now to put us into great breakout sessions. We've got 2 other moderators, Kathy Bobay from Illinois, excuse me. She's going to be in one of the moderators, and then Susan Buchholz is also, Dr. Susan Buchholz is going to be the other moderator. So we'll see you on the other side of this, and we'll have time to come together and share what we've learned and what we figured out with our discussion. and then we'll wrap it up from there. Thank you.